Hello, I've enjoyed this conference tremendously. The research sounds really super interesting. What I have to contribute is a bit more at a general level. I am a philosopher and I have strong interests in philosophy of science and philosophy of medicine. And I like to look at philosophical questions somewhat historically and contextually, rather than abstractly. I'd like to thank Vittorio Bellotti for inviting me. I believe he invited me because of the work I did in my book called Making Medical Knowledge. And one of the chapters in that book was about translational medicine. And that's really what I'm going to talk about, translational challenges in amyloid disease research. Vittorio gave me a very nice review to start me off on thinking about this area. And this is a review paper on Alzheimer's disease, so not on all amyloid diseases, but just on Alzheimer's. Even just looking at Alzheimer's, what comes over very strongly is two things: complexity. The mechanisms are complex, and heterogeneity. But not only are they complex, but they're not all the same in all cases of amyloid diseases or all cases of Alzheimer's disease. And this is a pattern that's quite common in medical research. And there's a recent book by Anya Plutinsky, also a philosopher of science, on understanding cancer that finds those two things there as well. There's nothing that's in common to all cases of cancer, and cancer is enormously complex. It's not just a genetic disease, for example. The first thing I wanted to bring up is a little bit of philosophy of science framework. Asking the question, what is a model? In the most general sense, what is a model? And models can be mental models, models that you have in your head that you're modeling the world on. And when the examples are given of this, it's typically things like, people have modeled the atom on the solar system. Or Kekule had this dream of a serpent catching its tail, and that gave him the idea for the benzene. What a model is some kind of representation of what it is you're trying to understand in the world. And it can be a representation in your head, but doesn't have to be in your head. It can be a representation that actually is in the world, like Watson and Crick's actual model of the DNA helical structure. So a physical model. It can be an equation, totally theoretical model. It can be an animal model, and it can be an in vitro model. And what animal models do is they attempt to bridge our lack of understanding of the full complexity of a phenomenon by using what we take to be a similar set of mechanisms in a related organism. So we don't understand them in full, but that's how we represent them, just by using a related organism. And of course, the assumption is that the related organism is like us, and that assumption falls short a lot of the time. In vitro models tend to be simpler, and they do sometimes succeed in representing a part of the complex human phenomenon that we're trying to understand, but often they end up being so simple that the translation of the knowledge achieved in vitro models does not extend to the in vivo human being. So modeling is what scientists do. They don't just gather data. They model, they attempt to represent, and they gather data that shows how well they represent, then they modify the models and so on. A quick statement about what is translational research. And I think we're a little clearer these days on what it is, but around 2008, when it started being the in thing, it was used to talk about almost anything. The core usage of the term has been to talk about going from bench to bedside and back. And that's both in vivo and in vitro models, both of them. And bedside is the clinical application. And the and back is to echo the kinds of things that Victoria was saying earlier about we need to know when we're going, why things don't work. So we need to be able to reason from a clinical failure back to improving our in vivo or in vitro model. So the main translational challenge is the number one, is the scientific translational gap. Sometimes what people worry about in translational research is how you get basic scientists and clinical scientists together to do the work. So it's a social, institutional, communicative problem, as well as an intellectual problem. And I just wanted to mention both problems because they're both there. Translational institutes have been set up so as to get over the second problem, to bring people together so they meet around the water cooler in better non-pandemic times. And scientific challenges are intended to be addressed by people working on teams together with different kinds of expertise. And well, the question is, can the gap be closed? And I want to show you a diagram that you probably saw a long time ago. This was from Nature in 2008. And it's called Crossing the Valley of Death. And the narrative goes like this. Here is the lab scientist. Here are his in vitro, here is his in vitro equipment. But this diagram is missing a lot of things and it's saying a lot of things. It could be analyzed ad infinitum. Notice that there's one scientist and it's a man. Something to notice. Okay, on the other side, there's a patient lying horizontally. The patient is probably a man. The doctor is clearly a man. They're trying to cross from the lab to the patient. And there's a very shaky bridge between them. And down at the bottom, well, I don't know whether that's supposed to be a former patient or whether it's just supposed to be an example of the collapse of a new attempt at therapy. They both are contemplating the difficulty in crossing that gap. And it's called the Valley of Death because so many potential therapies crash and burn there. And that means in phase 1 or phase 2 clinical trials. It's typically what we're talking about in translational medicine. Once you get to phase 3 trials, you're doing straight effectiveness research. But stage 1 and stage 2 trials are where you are looking at toxicity, but also looking at biomarkers that might indicate that whether something is actually happening in the patient. And they are, stage 1 and stage 2 are also the times where you get the and back for the bench to bedside and back. When this diagram was put up in Science, the big question was, can we prevent all the skeletons from dropping to the bottom? Can we prevent the failure of pharmaceutical products? And I think the figure of something like 9 in 10 fail before coming to market was put out. Obviously that's very expensive, it's very time consuming, and people would love it if they could just design a pharmaceutical and have it have 50% of the chance of success. That would be a huge increase. I just want to summarize a few things about what the Valley of Death is in amyloid research specifically. You all know this much better than I do. There's been a succession of hypotheses for the mechanisms of Alzheimer's disease, from cholinergic hypotheses to the amyloid hypothesis, to tau hypothesis, to inflammatory hypotheses, combined hypotheses. Hypotheses are models. There's a variety of them. We don't have consensus on any one. So the uncertainty about what we're modeling is a big contributor to the Valley of Death. Few drugs have been approved, 4 in the USA, all with dubious efficacy. So that's not much, although there are over 100 drugs under investigation. And most of you have said things like our models are too simple. And simplicity is a characteristic of our theoretical models and our in vitro models. Or our models do not generalize from animals to humans. Animals may be perfectly complex, but they may not be complex in the same way that we are. There are methods of looking for drug discovery via data mining of pharmaceutical targets. These are clues rather than full-fledged models, clues that something might make a difference. And there, what you're doing is you're tinkering without having a full understanding of the phenomenon. That said, a lot of medicine works that way. A lot of medicine works by tinkering. Basic science is more interested in understanding. Medicine's interested in curing. So it doesn't matter if we don't understand, say, the mechanism for aspirin, because we know it works. I mean, we'll use it. That's what medicine is about. Anyway, can we improve the success rate? I do feel I should mention Martin Whaling and Alexandra Wendler, who wrote a series of pieces on translatability scores, trying to predict how likely the translation was to be successful in translational medicine. I don't know how these papers have been received in the scientific community. I'm certainly skeptical myself. I think that the price of doing this kind of science is failure. I don't know that the failure rate can be improved. I think it just is what it is. And the only important thing is that we don't do the same experiment again and again because we're ignorant that somebody else did it and it failed. So the second set of challenges are social, institutional, communicative challenges. And I couldn't find a good diagram for this. There isn't one. This is at least there are a lot of people in it. It's not just one male lone scientist. What it doesn't depict is communication between scientific groups, social scientific institutions, relations of hierarchy between the individuals. This is at least the rainbow is supposed to, I think, evoke some idea of diversity, which is something. What do we know about the social structure of science? I'm going to mention a classic figure in the history of the sociology of science called Robert Merton. This is him. I'm mentioning him for a couple of reasons. One is a little bit of a personal connection. He was an undergraduate at Temple University, which is where I was, where I am, which is a very urban public university. He then went on to more elite institutions as he became more famous. His name was actually Meyer Robert Skolnick, but he made money to get to college by being a magician. He took on the name Robert Merton, and that name worked for him very nicely in a time of anti-Semitism, so he just hung on to it. He wrote a very interesting paper during the Second World War on what he called the ethos of science. And the word ethos is meant to evoke culture and ethics, both. So what is science like? And he said that it had 4 different principles. Universality, by which he meant science has universal standards, scientific method, and it also has democracy. Anybody who follows the methods can be considered a scientist. Communality, which he called communism, but that couldn't be kept because it just sent people off in the wrong direction. Communality is about the results of science being shared with others and about there being no secrecy. Disinterestedness is about not taking sides on what the results might be. It's about being neutral. And organized skepticism is about the scientific community's commitment to taking a systematically critical attitude to scientific claims. This probably did describe a lot of mid-20th century science. It may well be an ethos that somehow some of you, especially the older ones among you, were raised with. I was certainly raised thinking this, that this is what science ideally is. And of course, the reality is a little bit different. I've just listed a few things here that fall short of the Mertonian ideal. There's definitely a lot of lack of neutrality. Lack of neutrality can just be due to falling in love with one's model, despite translational failures. Some data is kept secret for commercial and competitive reasons. Commercial interests, sponsorship of research, ownership of journals influence what research gets done, what gets published, how much is published. There's definite bias in favor of positive findings from both journals and grant organizations, an over-reliance on impact factors in the dissemination of research, an over-reliance on just reading the abstracts among people who are trying to keep up with the literature, and a lot of competitiveness between individuals, labs, countries, and even research councils. And competitiveness increases secrecy, which is not good for science. So when I was talking about these issues with Vittorio, he used this phrase. He says, it's like being in a car that we don't know how to drive. Doing science these days, it's like being in a car we don't know how to drive. And I thought that was a wonderful metaphor. So I tried to find a graphic for it. But what it's telling us is there's a need for a new realistic ethos of science, and we don't have that yet. The way that science is structured socially falls short of what we think would be the best way to organize it. And we haven't had a lot of discussion about better ways of organizing science. In fact, things have developed largely unintentionally. I like this graphic because, of course, they're making it across the bridge. I would be happy to answer any questions.
Thank you very much, Miriam. Are there any specific questions for Miriam at this point?
So, yeah, thanks a lot for your excellent and very interesting talks. So, yeah, we have. I hope that that will help us to continue the discussion today afterwards. But this is really points to think how to communicate and think about falling in love in model, thinking about high impact journals and the reading abstracts. And
I see Fabrizio is unmuted. Is that the question? Please go ahead if you have a question. No. Okay.
So,
may I ask a question?
Yes, please.
Go ahead.
So thank you for your talk. I enjoyed that. And I think you highlighted some of the well-known problems. What I've always found with this problem with translation is it is really a translational problem in that the clinical and basic science communities talk totally different languages and have totally different reference points. So I think this meeting is fantastic today, but I think the gap from that for me is the gap. Is you've got someone who's talking Swahili and somebody else who's talking German, and how do you get them to come together? Because and it's not just a comfort thing, it's not just a sort of a habit thing, it's that we have a different lexicon almost, and trying to, I can show an ECG or an echocardiogram, and to me that's just what I do every day. But somebody who's basic scientists may never have seen that. So the words I use and the words that scientists use, we think are part of an everyday language, but they're not.
It's really interesting. I have come to think that the word translation in translational science is a metaphor, but the part that you're talking about, the language, that may not be a metaphor. That's about people getting together and figuring out what the other one is saying. I think the scientific challenge of going from one kind of domain to another, to call that translation is very much a metaphor. It suggests that we could hand it to a translation expert and they would do it. Yeah. Where it's really about tinkering. It's really about going back and forth between an imperfect model and a complex and heterogeneous reality. But I do appreciate your point about different languages of clinicians versus basic scientists.
And if I may, just a second question, what do you think COVID has taught us about translation? Because we've seen...
Yes, so I can't keep up with it. I was about to write this paper on translational failures in COVID, about how a lot of the early drug treatments all made sense from a scientific point of view, but gosh, they didn't work.
But the vaccine did.
The vaccine did, but the vaccine, there's still a lot of unpredictability about the vaccine that we don't know. The vaccine actually worked better than we thought, or we think it works better than than it was going to. So there are a lot of surprises all the way along. And we don't know whether the vaccine is going to work against variants, which is another translational issue, really. It's like if you translate it to a slightly different ecology, what's it going to be? What's it going to be?
I was thinking it was more, I mean, yeah, I agree with you. We weren't sure, we feared that it might not work. But we haven't reached the first anniversary yet of the first lockdown in the UK. And we've moved from an entirely new organism causing a pandemic to 10, 20, however many vaccines it is. And that's extraordinary scientific progress. I can't think of anything on that scale ever. So what are the characteristics of that endeavor, apart from blind panic, that have allowed us to make such rapid scientific advance in such a short space of time?
I guess it took down some, if I may comment, some of these barriers and the driving forces have changed, right? So, and for instance, some of the secrecy that you mentioned in the end, there's been like a common decision that this is going to be open as fast as possible. And even though there are commercial interests, it might have changed. So that I think the whole ethos discussion actually, I mean, was affected, at least for the COVID research.
Common interest, wasn't it?
Exactly.
So a lot of cash.
That as well. There's actually a question also in the chat from Christian Paul. So who do you think should or could develop such a new ethos without introducing a bias by their own background or interests?
Well, no one person, obviously. No one country, obviously. I think the international context is really good because it helps people see the arbitrariness of some of their own social structures in science. And it also offers a comparative structure to compare the different countries. You know, maybe a little bit what Perry says, discovering common interests and talking about those and what we need to do to reach those common interests. And I personally, I hope that the common interest isn't money too much, but yeah, I certainly think that thinking about the ethos of science and how do you change it, an ethos at all? It's not something that anybody can do from on high. It is to some degree about leadership, but it's about buy-in and so on. And it's about the ideas being out there. So it's about the creative ideas about how to open access publication. That's been a huge positive advance. You know, I think it would be great if there was some thought about what happens to the next generation of scientists as tenure track positions are few and far between. How not to push people out of this work. Yeah, I'm certainly not suggesting that philosophers have a role to play, a big role to play. They may have a small role to play because they can pick up on what are the shared values and you know, make comparisons with different scientific cultures and the history of science. So I think there's a role not just for philosophers, but for science studies in general, for historians and sociologists of science, as well as philosophers, to play a role in this, but not to lead or dictate.
I think so. Vittorio, maybe?
Yeah. I have the impression that it's more and more difficult now when we have a failure, both in the basic science, also in clinical research, to go back, to move back to the origin of our ideas, or to critically review our assumption. And I think there are many players in these difficulties, and I'm wondering if the reduced role of scientific societies is one of the elements, because scientific society are less influencing in the system. There is more individual narcissism of the single scientist, and a big role for companies, in particularly in life science and in translation. Do you think we should try to go back to give more role, and in particular to open to have the space for open discussion like this in the scientific societies, and to consider more important the multidisciplinary discussion than the multidisciplinary projects? Because I think multidisciplinary projects sometimes mask something that is not really working, but we have a little bit of multidisciplinary discussion. We have more multidisciplinary projects than multidisciplinary discussion like today.
Yes, I think that would be great. I think people get too much into their narrow technical specialties, and there's a role for specialty conferences. But there's also a role for conferences that bring people together with different levels of expertise or different areas of expertise. There's a philosopher of science, contemporary philosopher of science called Helen Longino, who, instead of Merton's 4 norms, she has 4 norms that she calls norms of objectivity, conditions for science to be objective. And they include things like having a forum for criticism, so having an open forum for criticism. And she includes responsiveness to criticism. So it's important to respond to it. It's not important to dismiss it, but it's important to respond to it. And then she talks about equality of intellectual authority as being an important thing, that these gatherings not be too hierarchical. I can't remember what the 4th one is. Shared values. The 4th one is shared values, just as Perry said. Only for her, one of the values in scientific inquiry has to be empirical success. So they have to care about that. So it's a nice framework, and a lot of people have found it to be more contemporary. It doesn't require people to be, for example, be free from bias, which nobody is. It just requires them to be responsive to criticism.
Yeah, so there's a couple of questions, but in terms of the program, we intended a short break and then a more general discussion, but I just want to check with the rest here, what's the status?
So, how it is? Yeah.
Yeah, I think I can comment on translational science. So I think a key point is that we don't have, or we have very few clinician scientists. So people with knowledge in clinical and preclinical work, they are very important bridges between basic science and clinical science. So in my institute, I favor this figure, but this require a long training. So because you need a vast experience in clinical work and preclinical work. But I think this figure has to be central for the future, because they can really make preclinical scientists and clinicians so talking, and they can really drive so the research in the right direction. So concerning, I mean, the very interesting things that Miriam raised, so the many problems. So of course, open science is what everybody would like to have. But we have, so I mean, the career of young scientists and also of established scientists is largely related to publication and grants and so on. And journals favors specific topics. So many times, I mean, George Glenner, we learn today from Vittorio, published a very important paper on BBRC, which is a very low journal, because higher journals were not publishing this small sequence of A beta, but this paper was very fundamental for the development of Alzheimer's research. So, I mean, there are many barriers that we should together as a community, but not scientific community, a more larger community, try to overcome. So this is probably young people are more prone, I mean, to follow this direction, but also the funding policy of research, the publication policy has to change quite a lot.
Lisa? Yeah.
I would like to add just one thing. I mean, it's true that it comes to the level of interaction among scientists, but wouldn't it make sense also to have a step back and consider also an education that actually can facilitate a different way of thinking rather than focusing only on technical skills? I mean, can really exist this interdisciplinary education that can have people growing up already with this tendency, let's say. Because I think in that sense, I agree with Fabrizio, it's a very, it is not about scientific community, but rather as a society, a way to kind of build in a different way. I don't know what Miriam thinks about this. I just throw in the discussion, but
well, you know, if I had my choice, everybody who is going to be a scientist would take some history and philosophy of science, and would have a broad science basis. You never know where the new ideas are going to come from, and creative people pull from a variety of fields, and there's no knowing in advance which ones are going to be useful. I think being in a university where there are all these different departments, and being in a college environment where there are different departments is much better intellectually than just being isolated in an institute where you talk to people who know your techniques.